Okay, so with this, as it became clear that the pandemic was going to have pretty significant impacts throughout the state, both on residents and the economy, we switched gears a bit and released a set of policy steps that we thought would help the state have the resources needed to weather a health and economic crisis. Today, we're going to walk through 5 major areas where we released policy proposals that we thought could have a significant impact, starting with Medicaid expansion and then moving through SNAP, paid leave, unemployment insurance, and small business assistance. So with record numbers of people losing their jobs, there are also probably going to be significant numbers of people losing their employer-sponsored healthcare. And we believe expanding Medicaid kind of as soon as possible would help quite a few of those people. In 2018, 67% of people in the working age population were enrolled in employer-sponsored health insurance plans. The majority of those newly employed are going to be looking for alternative coverage right now. Some are going to be able to turn to COBRA, although it can be prohibitively expensive for most people. Short-term insurance is available, but the coverage is extremely limited. Marketplace coverage through the Affordable Care Act will be available to anyone, but not anyone can get a subsidy. And so it may also prove unaffordable for some. Importantly, those with incomes under 100% of the federal poverty level are not eligible for subsidies. And some of those people are going to be able to access Medicaid, but there are eligibility limitations. On this side, so people with incomes below 100% of the poverty level need to not only be low income, they also need to fall into a category of eligibility. In Nebraska right now, that's elderly, persons with disabilities, children, and caregivers. And so childless adults cannot access Medicaid right now unless they otherwise are elderly, disabled. So in accordance with the ballot initiative passed in November 2018, Medicaid expansion would broaden eligibility to those with incomes below 138% of the federal poverty level, or just under $18,000 a year, regardless for adult whether an adult fell into another eligibility category. The state would receive a 90% match on benefits provided to the expansion population, which is a much higher map than traditional Medicaid, even after the 6.2% bump in what's called the FMAP provided in the federal stimulus package. That brings us to just under 60% for the traditional Medicaid population. Implementation of Medicaid expansion has, however, been delayed as DHHS has sought a demonstration waiver imposing community engagement requirements on the expansion population. The plan was announced in April 2019, the same day that the state filed its state plan amendment for Medicaid expansion, and it would create a 2-tiered benefit plan. Under the original plan, all enrollees were to start in the so-called prime plan, which would be all traditional Medicaid benefits provided right now in the state. But they could drop to a basic tier, which is all of those benefits minus dental, vision, and over-the-counter medicine for failing to comply with certain community engagement and health maintenance requirements. The waiver also would eliminate retroactive eligibility, which allows providers to be reimbursed for care up to 90 days prior to to an eligible person applying. Enrollment was set to start August 2020 with implementation in October 2020. The virus has had an impact on the state's plan. So CMS has said that it can't review the application prior to October. And so DHHS is going to have the expansion population start enrollment on that same August-October timeline, but everyone will start in the basic tier and they won't be able to move up into prime until the application has been approved. CMS has also said that because of the virus, it's not going to approve the retroactive eligibility piece. And so the current retroactive eligibility rules will apply, which means that enrollees who start, once implementation starts in October, that population will not have any retroactive eligibility because they couldn't possibly have been eligible before that date. So yeah, with this, there are things that the state could do. We think Medicaid expansion could happen sooner. The state has already taken a lot of steps towards getting its systems ready for the expansion population to start enrolling. Some other states have also tweaked their retroactive eligibility to allow people who apply for Medicaid to have a longer retroactive period. So providers can be reimbursed for a longer period leading up to that person's enrollment, so long as they were otherwise eligible during that time. So moving on to SNAP. SNAP is a program that provides nutritional support for low-wage households and those on fixed incomes. The intent of the program is to fill the gap between what a family can afford to spend on food and the cost of a thrifty budget as determined by the USDA. As a result, as a household's income increases, its benefits decrease. And here on the right is just a graphic with some of the things that you can and cannot purchase using SNAP benefits. It is pretty limited. You can get fruits and vegetables, meat, poultry, fish and dairy, snack foods, non-alcoholic beverages, seeds, and even plants for food. You can't get any hot or prepared foods, no beer, wine, liquor, tobacco, and no vitamins, medicines, or supplements. In Nebraska, all households must have net and monthly incomes below 100% of the federal poverty level, which is about $2,000 a month for a family of 4. And those without an elderly or disabled member must also have gross incomes below 130% of the federal poverty level. And no household can have liquid assets more than $25,000, and that would be cash or anything that could readily be sold for cash. Benefits are paid 100% by the federal government, with administrative costs split 50-50 with states. In 2019, $220 million on benefits were issued to Nebraskans at a cost to the state of $19 million. The bulk of that $220 million was spent locally, which makes SNAP a really efficient form of economic stimulus, especially during an economic downturn as we're entering. Analysis of the federal stimulus during the Great Recession showed that for every dollar of SNAP benefits redeemed, local economies saw $1.70 in economic activity. As seen in the chart, the dollar gets spent at the retail level, and then that grocery store or entity can hire back staff, pay bills, make other investments. And then as that dollar kind of moves along through the supply chain, each business that sees a piece of that dollar gets stronger. And so your economy recovers in pieces. But it also, because SNAP benefits get distributed and spent very quickly, it's a very fast form of stimulus. You can get money into local economies really quickly. And in recognition of this kind of economic multiplier, the federal government recently gave states a lot of flexibility in tailoring their programs to respond. Nebraska applied for almost all of the waivers possible, with the exception of one allowing benefits to go to families that are now having to replace school meals at home. There is one other thing the state could do, however. So the state could, there is a bill out there that would increase the income limit. It would only go an additional 10%, but we have the state has the ability to go all the way to 200% of the federal poverty level, which would be $4,292 a month for a family of 4. Nebraska is one of only 9 states to have kept the income limit at the lowest possible threshold. That's the lowest allowable amount, is the 130%. And 17%, including several of our surrounding states, have increased it to 200%. And Renee mentioned earlier that Nebraska ranks really low in the amount of federal funding that comes into the state, and both of expanding access to both of these would increase the amount of federal dollars coming in. Because SNAP, all the benefits are paid by the federal government, it ensures it's really efficient for the state government, and Medicaid also. We are second lowest, I think, in the amount of federal money that comes in for our traditional Medicaid population. And so it would help significantly to help expand access. With that, I am going to hand it off to Craig, who is going to discuss paid leave.
Okay, thank you, Tiffany. So in light of COVID-19, there has been a fairly significant federal response. One aspect of that response has been the temporary extension of paid leave benefits through the Families First Coronavirus Response Act, which is also known as the FFCRA, and that was passed in March by Congress. So I will talk about the distinctions between the types of leave, but first I'd like to discuss the workers that are eligible to receive the temporary paid leave provisions through the FFCRA. So the paid leave that is mandated applies to companies with fewer than 500 employees. And employers that employ fewer than 50 may request an exemption, and it also allows the Department of Labor to exempt certain employees, including healthcare providers and emergency responders. Next slide, please. Okay, so as I mentioned, there is a distinction between the types of leave and whether they are paid or not. So paid sick leave is typically an employer-provided benefit that gives employees time off for self-care or family medical needs, at which the employee is, again, typically paid their normal wage. Family and medical leave, also known as FMLA, is job protection for eligible employees that allows up to 12 weeks per year of unpaid job protected leave for specific family and medical reasons, and it requires the employer to continue providing group health insurance coverage for the employee. FMLA is federally mandated for public employers and private sector employers with more than 50 employees. Some states require employers to provide paid sick and or paid FMLA, but Nebraska does not require either. Next slide, please. Okay, so now I'd like to talk about the specific paid leave provisions that are contained in the FFCRA. So employees who get sick or are quarantined and unable to work because of COVID-19 can take up to 80 hours of paid sick leave at their regular rate of pay, up to $511 per day. This again only applies to COVID-19 related illness. Similarly, employees are offered 80 hours of paid sick leave at 2/3 of their normal wage, up to $200 per day, if the employee cannot work because they need to care for someone either under quarantine or they need to care for a child whose school or daycare is closed because of COVID-19. The second type of leave that was extended through the FFCRA is extended family and medical leave, which grants covered employees up to 10 weeks of leave at 2/3 their normal wage, again, up to $200 per day, if the employee cannot work because they need to care for someone subject to quarantine or they need to care for a child whose school or daycare, again, is closed due to the pandemic. Both paid leave provisions in the FFCRA, as I mentioned previously, only apply to companies who employ fewer than 500. Those employers will be reimbursed by the federal government up to the maximum amount via payroll tax credits or a refund if the amount exceeds the payroll taxes paid by the business. Next slide, please. So the pandemic has highlighted a gap in states that do not require employers to provide paid sick leave and paid family and medical leave. Without such policies, again, either at the state or federal level, workers are faced with a difficult situation. Work while potentially ill and risk the spread of disease, or stay home without pay and risk unemployment. While some employees will be guaranteed such paid leave during the pandemic, it's also important to remember that not every employee is covered. Companies who have more than 500 employees are automatically exempted from this provision in the FFCRA. Further, these paid leave provisions will expire at the end of the year of this year, 2020. And as I've mentioned, they are only related to the COVID-19 pandemic. They do not apply to any other illness or event. So it is important to consider paid leave for every employee, and the pandemic has highlighted why. Not only does paid leave help both employees and employers by limiting fellow workers and customers' exposure to illness, research has shown that paid leave does, in fact, reduce the transmission of viruses. So with that, I will hand it over to Alex.
Thank you, Craig and Tiffany, and good morning, everyone. I want to go through some basics of how unemployment insurance works in Nebraska. For starters, the benefits are paid out of the state unemployment insurance trust fund, which at the beginning of 2020 had just over $456 million in it, which is actually really good for a state of Nebraska's size. But even with the fund being pretty well stocked prior to the pandemic, there's not nearly enough there to cover the levels of claims that we're seeing. I mean, no state was prepared for the sort of crisis in unemployment that COVID-19 brings about. The Commissioner of Labor in Nebraska, John Albin, has said that the state has spent about $100 million from this fund on unemployment insurance benefits since March 1st. And that, for a frame of reference, the states had provided $67 million of benefits total in all of 2019. So we're just about doubling that in under 2 months. And there's that's probably not going to abate in the coming months for the rest of 2020. There have been a little under 117,000 initial claims for benefits in the state of Nebraska since the onset of the crisis. So that's about 11% of Nebraska's labor force. So again, we're seeing huge amounts of claims from people who are out of work. And it will eventually end up straining that unemployment insurance trust fund. And some other basics about the program. Unemployment insurance in Nebraska replaces 50% of a worker's average weekly wage, and that's capped at half of the state average weekly wage, which is currently $440. Both of those metrics, that wage replacement rate and the weekly cap, are pretty middle of the road for states, so not particularly high, not particularly low when compared to other states. Workers in Nebraska can receive benefits for up to 26 weeks in a year. And Nebraska also does offer a work share or short-time compensation program, which around 30 states offer. And that allows employers to uniformly reduce employees' hours by a certain amount across the board, and then allowing, in turn, those employees to receive a prorated unemployment benefit. So this is an extremely beneficial program because oftentimes the other option for employers would be to lay people off. So this can be effective in avoiding layoffs while having the state kick in some money to keep all of the employees at their same pay rate, even though some hours are being reduced. If you wanted to, next slide, please. So a couple of key things that under normal circumstances, Nebraskans need to meet to qualify for unemployment insurance are work search requirement. So that requirement begins at making 5 job contacts and 1 application for suitable work per week. The requirements ramp up pretty fast, and kind of at the highest tier of requirements, by week 14, an applicant needs to be making 5 job contacts, at least 4 of them on different days of a week, and 2 applications for suitable work per week. And for reference, suitable work is defined in statute as work that offers average gross benefits higher than the weekly benefit that the applicant would be receiving from unemployment insurance, and also quote unquote within the individual's capabilities. And I'm assuming that is kind of a judgment call by the people reviewing the applications. There's also a minimum earning requirement that applicants must meet, and that's making at least $4,135 in the first 4 of the previous 5 quarters, and that includes at least $1,850 in one quarter and $800 in a different quarter. So need to have at least that amount of income in 2 of the previous quarters. Next slide, please. Something really important to highlight about unemployment insurance in Nebraska is that in the final quarter of 2019, Nebraska had a UI recipiency rate of 10%, which means only 1 in 10 eligible Nebraskans were receiving benefits. And this actually ranked 49th out of 50 states, ahead of only Mississippi. And for reference, 30 states have a recipiency rate of at least 25%. So, I mean, even just to get in the ballpark of most states, Nebraska would really need to up that recipiency rate. Again, this is all prior to COVID-19, but it highlights that the system in Nebraska wasn't necessarily working to the full extent that it could, and wasn't really ensuring that people that could use or needed unemployment insurance were receiving it. So next slide, please. Some changes that have been made during the COVID-19 crisis to loosen requirements and make UI more accessible. So a mid-March executive order waived that work requirement that or work search requirement that I mentioned earlier. It also waived the waiting week to start collecting benefits. Normally, there's kind of a week lag between approval of an application and starting to receive benefits. So that was waived so that people could receive benefits immediately. And that unemployment insurance trust fund that I mentioned earlier is built up through basically an unemployment insurance tax on employers. And those charges were waived during the crisis so that employers were no longer paying into that fund. There was a second executive order at the end of April that basically helped speed up processing of unemployment claims, because the system's been very understandably overwhelmed with how many people are needing to get involved, and also extended eligibility retroactively back 1 more week prior to March 15th, when people could initially only receive or have eligibility on March 22nd. So 1 slide forward, please. And I want to wrap up the UI discussion with a couple of potential policy changes that we've taken out of this crisis. The crisis has highlighted the importance of UI and how much people rely on it on a time like this to keep their head above water. So the first and very striking one is to find a way to raise the UI recipiency rate in Nebraska outside of a time of crisis as well. So the work search requirements I mentioned can be pretty onerous, particularly for rural Nebraskans. So if you're thinking about 5 job contacts on 4 different days of a week and 2 applications for suitable work per week, I mean, that can be a lot to put in week after week, especially for maybe those in more isolated communities. So that could be potentially one way to get benefits out to more people. And second, the earning requirement I mentioned can disadvantage low-wage workers. Some states have either a minimum hours worked requirement or a combination of like a lower lower earning requirement than Nebraska, in combination with some proof of hours worked in the previous year. States that do that, like New Jersey, Oregon, Washington State, have a much higher recipiency rate than Nebraska. So that could be a contributing factor, is to focus more on hours worked in the previous year rather than money earned. And then the second recommendation is probably less pressing, but definitely worth having a conversation about, is raising the wage replacement rate in Nebraska and the maximum weekly benefit. Like I said, the current amounts are pretty middle of the road for states, but if you actually break down what that benefit and weekly cap mean, a minimum wage worker would be receiving $180 a week in UI benefits, which is the equivalent of less than $10,000 per year. So really thinking about if minimum wage workers who then are forced to go on UI in the case of a crisis like this, if that's really enough to survive on. And then even the cap, so if you're making the maximum, or if you're receiving the maximum benefit, you're able to, that's the equivalent of $11 an hour, or just under $23,000 a year. So again, number one focus should be raising that recipiency rate, but it's definitely worth opening a conversation about the amount of benefits as well in the future. Next slide, please. The last sort of pandemic policy response that I want to touch on is small business assistance. I mean, obviously small businesses are being hammered throughout this crisis with the everything that's going on. And something that's been in the news a lot that I'm sure you all have heard some about is the payroll protection program from the federal level. Congress has devoted $660 billion so far to this program. And out of the first pot of money that was doled out, Nebraska received a little over $1,500 per capita, which was the 5th highest out of any state. So that was great to have that money coming into Nebraska. But probably the second part that hasn't been necessarily discussed as much as the payroll protection program is the coronavirus relief fund, which sent $1.25 billion of direct fiscal relief to Nebraska, with a portion of that being allotted to Douglas County. And the Treasury guidance has established that that money can't be used to backfill revenue, but costs related to providing grants to small businesses to reimburse the costs of business interruptions are actually eligible expenditures of those fund payments. So obviously, the state of Nebraska is going to have a ton of competing interests for that money, and it's hard to say what priorities it will end up going to, but it is important to note that business assistance is an option for how some of that money could be spent. And if you go to the next slide, please, you will see that some other states are using that money or some money to be reimbursed by that federal pot of money on business assistance. Idaho is devoting about a quarter of its total CRF funding to individual business grants. There are a couple other examples on here of what Florida and Maryland are doing. So Nebraska could look into doing something on the state level to support small businesses that have been hurt in the crisis. But again, there's going to be a lot of competing interests for that federal money. So there's some decisions to be made down the road for sure. And that's all I have on business assistance in UI, but our contact info is here. I'm sure that Craig, Tiffany, and I would be happy to take any questions.
We would indeed be happy to take questions.
I have one.
Mm-hmm.
So I wondered if you have any idea of how many companies with over 500 employees don't already pay for sick leave. I mean, is a lot of them because they call it paid time off and that's not necessarily sick leave? And does anyone know what that number might be?
I don't know the answer to how many companies are above 500. Renee, do you know if
Or
the
you know of any company that's not paying? I mean, that's over 500 that it doesn't have a paid.
There are some grocery store chains that I was reading about that have over 500 employees and they're not offering sick leave. I couldn't tell you off the top of my head which ones, but there were a few.
Mm-hmm.
Lisa, I'm not we can see if we can find some data, but we don't know the answer to that question.
Well, I don't have to know the specific number. I was just curious if anyone knew of any of the, because obviously they're large companies. Just be aware of it. I know that, like, I have a relative in Arizona that works for some kind of medical company, and they're over 500 people, and they don't pay, and they're not gonna change their policy. So, I mean, so it does happen. I just wondered in Nebraska if we knew if there were situations like that.
I'm sure that there are, but I don't know any way to identify that unless in any sort of systematic way,
Mhm.
just word of mouth. But
Sure.
there are probably some national statistics though that we could find, percentages.
Mhm.
While there's a lull of questions, I did want to note that a lot of the research that Tiffany, Craig, and Alex just talked over you can find it on our webpage. They've done a lot of work over the last month and a half or 2 months. And it's right there at the top. If you visit openskypolicy.org, you can see all the work they've been doing in this area.
And we can send that link as a
But
follow-up.
that will be in the follow-up links too.
Okay.
Anybody have anything else?